Sorry. This patient, 5-year-old child Ali, has come with has been referred by GP for history of fever for last 2 weeks. Child is a non-case of congenital heart disease, operated at the age of 9 months.
Okay. Okay.
So if you want to gather for 2 minutes, you can.
Name is Ali, right?
Ali. Yeah.
Okay. Accompanied by his mother.
Father.
Okay. I'll just take 1 or 2 minutes. Yeah, I'm ready.
Okay. Who will keep time? Hiren? Hiren?
Yeah, just a minute.
Hiren, timing.
Yeah.
Okay. You can start, Dr. Tahir.
Okay. Uh, Hello, mom. How are you?
Father.
Okay, father. Okay. Uh, Hello. Good evening. What is the name of father?
I can say Ahmed.
Ahmed. Okay. Hello. Good evening, Ahmed. Good evening, Ali. How are you doing?
Yeah, good evening, doctor. Actually, we are waiting to see you.
Yeah, I'm Dr. Tahir, one of the pediatric registrar here in the unit. So, how are you doing? How was the journey to the hospital?
Yeah, doctor, it was good, and we are here for the Ali's fever. This is long. My child is suffering a lot, so I think you could be the best person with whom I could discuss and get some treatment.
Yeah, thank you. So, I'll ask few questions regarding the condition of the Ali, and I'll make few notes if you don't mind.
Yes, doctor.
Okay. So you're saying that Ali is having fever for the past 2 weeks. Is there anything else with the fever, like body aches, joint pains, any rash?
Yeah, doctor, he had some rash over his, you can say, palms, and
Mhm.
he has joint pain also. A few days back, he complained like moderate pain in his joint, and he was okay with some aspirin. This analgesic Brufen was given that for that.
Right. So you mean that the temperature and the pain, they responds to aspirin.
No aspirin. It's Brufen, doctor.
Brufen,
Joint pain
sorry.
itself.
Okay. So anything which makes these things worse, any time of the day or any walking or anything which makes it worse, the pain and temperature?
Like pain is not there in the joint, doctor. Only now temperature is there. After Brufen, that pain
Right.
subsided. But now
Okay.
temperature is like it comes every day, and it subsides temporarily with the paracetamol. And
Hmm.
during temperature, he gets very weak. And also he is not very active nowadays.
Hmm. Is it the fever all the day, or is it specifically coming with swinging pyrexia in the evening, associated with shivering, or all the day it's present?
Shivering is not there, doctor, but you can say like only till the effect of paracetamol is there, the temperature
Right.
subsides, and it comes usually after 6 to 8 hours. Every day it is coming, doctor.
Okay. Okay. You said that there is some black spots on the hands.
Mhm.
Is it under the fingers?
Yes,
Under the
doctor.
nails, I mean?
Yes, yes, yes. They were at the fingertips, and they were quite
Mhm.
painful, doctor.
Right. Is there any swelling at the nail beds?
No, doctor. There was no swelling at the nail beds.
Any swelling at the pads of the fingers, distal fingers?
Yeah, I told you that there some blackish spots were there. Apart from that, no, like painful black spots were there, and they are still there, doctor.
Any redness on the palms and soles? Rash
No,
like?
doctor, not noticed particularly like that.
Did anyone told you that he has enlarged spleen?
GP did not say like that, but he said like this fever is for last 2 weeks, so we need to do some workup. He did some basic test, and he
Mhm.
said like there is some could be infection, and as fever is for prolonged period, so needs detailed workup.
Right. So uh, before these 2 weeks, was there any procedure like dental procedure or any surgery, abdominal surgery or any procedure,
Mm,
recent procedure?
No, doctor, there was no procedure, but you say, see, like his teeth are not good. He's taking bottle feeding. He was taking bottle feeding for a long time, and he had significant dental caries, doctor.
Right. But no recent procedure.
No recent procedure, doctor.
Any recent wound over the body, over the skin?
No, he keeps playing and get frequent abrasions here and there, but we never gave attention to that. There was no such concerned significant wound in recent times.
Okay, Ahmed, do you remember what were the tests which were done by the GP?
Like they said, like CBC it was done and CRP and
Mhm.
urine test was done, and they said like there is some blood in the urine,
Okay,
and
okay.
so they said like they need to do some blood culture, but it was not available at the GP levels. We just gave paracetamol and referred us to here.
Yeah, thank you, Ahmed. Thank you for the information. Ahmed, did you take any treatment for this from the GP except this ibuprofen, which you told me? Any
Uh,
antibiotics?
Apart from ibuprofen, like I demanded antibiotic, but he said like it is not something routine, so better you get some
Right.
detailed investigation, then better to take antibiotic.
Yeah, thank you. Well, you told me in the beginning that he had a surgery at 9 months of age. Can you tell me what was that surgery done for, if you know exactly?
Mhm.
And
Like
the
doc.
second is,
Mm-hmm.
yeah, and the second is he taking any medication post surgery?
Mm-hmm. Actually, doctor, that he was diagnosed as a case of heart disease. Like they said, like there's some hole between the lower chambers of the heart, and
Mhm.
he was operated then at the age of 6 months, 9 months, and after that he was quite fine. But like they said, like a child may be at some risk in later life, so better be on. So we followed for few years, like 2 3 years. He was on follow. After that, they discharged us from there,
Right.
and
And what about
initially
medication?
they did not put us on any. Initially, for 9 months, he was on some medications. I don't remember the names, but he was on some medication because he was not putting weight and he was getting breathless, and he
Right.
was like not taking feeds properly. He was getting tired. Those medications were started.
Yeah, thank you, Ahmed, for the detailed info. May I ask you, is it the first time he's having such prolonged fever
Yes, yes,
after
doctor.
surgery?
Yes, yes, doctor. This is the first time he has fever.
Okay. Had he had some weakness of the limbs or one side of the body before or fits?
No, 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 doctor.
Okay. Had he had before any problem like blood in the spool, coughing, yeah, breathing difficulty?
No, no, doctor.
Okay. Yeah, you said now there is a blood in the urine. Before there was something like this?
No, we did not notice actually. The report is showing some bleeding in the urine.
Yeah. And after this surgery, were you doing follow-up routinely in the OPD?
Initially, for 2 years, we were following up. The tests were not done, but they were just monitoring his growth and how he's like doing regarding overall development. And for vaccination, we used to go regularly.
Yeah. And were you told by the doctor that you will take antibiotics before surgery?
They explained us that any your dental extraction or any surgery, then they have told us to mention to the doctor that he had surgery at a younger age. Then doctor will decide regarding.
9 minute finish. You have remaining 4 minutes.
Okay, thank you. Well, is there anyone in the family with cardiac problem or any joint pains or anything, any
No, no,
other
doctor, I
disease?
don't remember such.
Okay. And can you tell me that Ali, he is on some special sort of diet, like salt restricted diet?
No, no special diet, but initially, like first year of life, he was seen by a dietitian, and also after surgery, he was
Mhm.
given some special diet for weight gain.
Okay. So, Ahmed, how is the vaccination of Ali? Is there any extra vaccine, like flu vaccine,
Yeah,
annual,
they
or
have
anything extra?
advised us flu vaccine, and we are taking it regularly. Every year
Okay.
we are taking it, and other vaccines are done as per the schedule.
Right, thank you. So, Ahmed, can you tell me that how is Ali? Like he currently, like he can walk by himself, can go up and downstairs by himself, or is there anyone who supports him?
Doctor, he is weak, but he is that way okay. Also, his appetite is also not good, but he can
Mhm.
manage. He can go to the toilet and he plays sometimes also. It's not like
Okay.
bedridden.
Was he ever advised monthly intramuscular injection of a drug named penicillin, or is he
No, no,
currently
doctor.
on that?
No, no,
Right,
doctor.
thank you.
No,
Thank
doctor.
you. Okay, so finish, or is there any time left?
You have 2 minutes still.
Okay, so Ahmed, have you ever done a cardiac test like echo for Ali?
It was done when he was a child, and I told you
Right.
that there was some hole in the lower chambers. And
Mm-hmm.
after the surgery, also they did twice.
Mm-hmm.
Now the GP was saying like he may need that jelly scan of the heart.
Right. Right. And is there any abnormal movement noted during this fever period?
No, no, doctor, no, not like that.
Right. Okay.
Mm.
So I think I have
Okay,
done.
if you're done, then we can summarize your case. You can summarize to first to role player.
Yeah, 1 minute is there.
For this summarization, you will get a time, or you
If
will
you
directly
have time,
summarize.
you
Directly.
just to buy time to complete 13 minutes. If you remain, then you can summarize to role player that today, like these are the things he
No,
did
no.
in the.
I mean, like I have time, but if I want to gather myself and
Mm.
summarize it, he will give me time.
No, after 13 minutes, you have to immediately summarize to the examiner.
Okay, right. Okay, so I'll start.
Yeah.
Uh, okay, today I was asked to take the history of Ali, who is 4 years old boy, accompanied by his father, with a history of high-grade fever continuously for the persistent high-grade fever for the past 14 days. There was a gentle rash over the extremities, and there was mild joint pains, but not that much significant. The pain usually improves with ibuprofen, which was prescribed by a GP, which they visited a week back. There was no antibiotics taken or any other drug except this ibuprofen. Notable thing is that of a surgery which was done at the age of 9 months for some cardiac problems, but they don't know what was that surgery for. But on the history based, most likely it was a VSD surgery. Post surgery, there was no medications advised. Ali was well over after this surgery till 4 years of life, until he had this episode of high grade fever. And this is the first time he's experiencing this episode. There is no recent history of any dental extraction or any surgery. So, based upon all this history, most likely, I think this is a case of infective endocarditis with the differentials of rheumatic heart disease. That's it.
Okay.
Or
Okay.
SLE, maybe SLE on the bottom,
Okay.
because there is also rash.
Okay. Okay. So, how will you investigate this child? Hello.
Hello.
How will you investigate this child?
Yeah. So first of all, I would like to do an echo for this child, as well as would like to have a blood culture immediately, at least 2 to 3 blood cultures on different occasions. And I'd like to do routine labs like ESR, CRP, urine, which is already done, so, and CBC.
Mm-hmm. So, why do you want to take blood culture at different occasions?
Yeah, because I'm suspecting this as a case of infective endocarditis. So, according to the Duke's criteria, you need to have a blood cultures at least 2 positive on different occasions.
Yes, right. But why at different occasions? Why it is like that?
I'm
What's
sorry,
the
I don't
reason?
know this. I'm sorry, I don't know this.
Okay, not an issue. So, like, what do you expect on the echo in this child?
Yeah, on echo, I can see vegetations over the valves, or if there is a prosthetic valve replacement already done during that surgery. So there can be dysfunction of that valve,
Mm-hmm.
and there can be wall insufficiencies.
Mm-hmm.
But most important is the vegetations which
Mm-hmm.
can be seen on the valves.
Okay, okay. So, what are the complications you can expect in a child with infective endocarditis?
Well, the complications, as I mentioned, that it can be there can be severe sepsis, there can be strokes, there can be cardiac dysarrhythmias, and there can be splenomegaly. There can be remote complications like that of the Osler nodes, painful lesions, the Geneve lesions, the sphincter hemorrhages, and
So, what are the common organisms in children less than 5 years of age? Which
yeah,
cause
the most common organism I think is the Streptococcus, Streptococcus viridans, I think,
yes.
and followed by Staph aureus.
Mm-hmm. So, if we don't get this blood culture positive, so how will you like choose the antibiotics for the
I'm
child?
sorry, Sandeep. I cannot.
Hello.
Your voice is break.
Sorry, the network issue little bit.
Yeah,
Okay.
yeah. Now it's better. Yeah,
Okay.
yeah,
So, like, what are the
yeah.
antibiotics
No.
of choice usually in the less than 5 years of child? How you will start choose initially the antibiotics? Which antibiotics are preferred initially?
Yeah, until we have not got the blood culture, we will start with empirical therapy. So the empirical, I think the best one is that of the vancomycin with a gram negative like gentamicin, or there are a lot of different combinations. Like
Mm-hmm.
it can be ceftriaxone with aminoglycosides,
I
or
don't know current protocol. I'm just
it can
asking.
be
I thought
penicillins with vancomycin.
vancomycin, gentamicin. So usually, how long the treatment is given and why it is given so for a long period?
Yeah, usually it is given for 4 to 6 weeks, and the reason being prolonged treatment is that the blood supply to the valve is very poor. So that's why we need to give it a long to eradicate these organisms.
Okay, okay, okay. My questions are finished. Anybody else wants to ask? Kiran?
Yeah. So,
Right.
what is the modified Duke criteria?
Sorry.
What are the diagnose? How you will diagnose infective endocarditis?
Yeah, for infective endocarditis, we have a criteria which is called Duke's criteria or modified Duke's criteria. It has a major criteria and a minor criteria, and the diagnosis being two major, or one major plus two minor, or five minor. The major things are positive blood culture on two separate occasions, and evidence of vegetations on echo. These two are the major. And the minor, they are being the embolic signs like the Janeway lesions, the sphincter hemorrhages, and the Osler nodes, and the clubbing, splenomegaly, and the raised ESR, CRP, and hematuria. These are the minor criteria. So two major, one major, or two minor, or five minors.
In this child, there were features. What was there in minor criteria? Sandeep, you mentioned, you asked also. There was a
Yeah,
fever. One was
yeah,
fever, second was
fever was there. There was arthralgia, like he told me, there is mild pains. There was sphincter hemorrhages, and because there was painful lesion, so most likely that was the Osler nodes.
yes, that was
And
also.
yeah, and he said that ESR CRP done, but he did not tell me the result, so I don't know. But hematuria he told me, so that is also one of the major minor criteria positive with this.
I think the two different side culture is because the most common organism is the staph and strep. So just for the sake of, I think,
Actually, what not different? Why different occasions? Because this bacteremia is
Yes.
not continuous bacteremia; it is intermittent bacteremia. So to get
at the time
yield,
of fever only you want
maximum
to collect.
chance of getting yield, it is taken at different timings.
And that should be
Okay.
at the time of fever only.
Preferably at the time of fever.
So it is just like malaria.
This you can say like that.
Yeah, because we make slides when there is high grade fever.
Right, right, right. And this like bacteremia, as it is intermittent, that anyways that usually infected endocarditis cultural is very less, not more than 40-50%. So to make it
Yes.
maximum possible, so it is at different timings. Otherwise, like we like feedback regarding like you are already like your boss, but few things like
Yeah. Thank you.
asking questions like one question at one time. Please,
Yeah. Yeah. Yeah.
usually not to be combined two, three questions in one go.
Yes. Yes. Right.
So, like, if timing is there, then you can go about birth history, development history. And if
Okay.
timing is there, if you still had 1 minute time, then you socialist you did not ask at all.
Yeah,
Yeah.
social was totally missing.
Yeah,
Yeah.
social. That's
Yeah,
why.
actually, I was not. I was sitting in the other room. There was no clock in my room, so I was very scared. I thought it's a big topic, and I'll leave some things.
In
That's
in
why
ex-
I omitted.
in exam also you will not get any clock. You are not supposed to wear wristwatch.
Ah, right.
So once this
Okay.
4-minute alarm is there, then move to the social and important like
Right.
allergies also you forget
Right.
to ask. Allergies, social
Yes.
and drug history is very important. Like
Yeah, I asked
usually,
about drug,
yeah,
but
you
he told me
asked.
that he's
I'm just mentioning it again. You asked regarding drugs.
yeah.
Social was completely missed.
Yeah,
And
I knew these things. I knew these things.
yeah, everybody knows, but just whatever
No,
missing.
actually, I have a mnemonic.
Yeah.
I follow usually mnemonics.
Uh-huh.
So I deliberately omit these things because of the scare of
Right.
shortage of time. But
Right.
you're right. You need to fetch
Timing was there,
everything.
no? Otherwise, it
Yeah.
will not get penalized. But timing is there, still not asked. Then it's the issue. Uh, Otherwise, good. Like your history taking is quite good overall.
Also, Dr. Tamanna or Hiran, the Dr. Pankaj.
One time you mentioned pyrexia swinging. You asked like that. That was something looking like a
Yes.
odd. You mashed up two questions at a time.
Hmm.
You asked to the mother or to the father, like, was it kind of swinging pyrexia?
Yeah, usually I ask the question like this, that is there any swinging pyrexia in the evening? Because usually in infective endocarditis, they say that there is evening swinging pyrexia. So swinging
Fever is
means like high grade fever.
I did not know this evening swinging. I know that when there is septicemia, that is for malaria, na? Malaria, when they release the parasite, there is
Yes.
cool temperature, not for infective endocarditis. In
Yeah.
infective endocarditis, we take different punctures because
Yeah.
sometimes the patient, this infective endocarditis thrombi, actually the focus thrombus, okay, they may not be available from one side of the blood. So that's why from different side, three different side, that is called three different bottle, three different time. Like we take one set of bottle for aerobic, another set of bottle for anaerobic. So at least 6 bottle blood, and that blood actually we take from the three different venous site, because they said that infective emboli, these are not lodged in every part of the blood. So we take different part of blood from the body and different time actually. But it is also said that if the patient is very toxic, like high grade of fever, there is a chance of heart failure, or there is murmur, like for valve involvement, you can take blood within very short time from three different sites. Another, they said that in subacute variety, you can take 2 sets of blood from 2 different sites and then start antibiotic. What happened before taking blood, you cannot start antibiotic. That's why the more delay you do, the more will be the treatment delay. That's why even within 1 hour after another, within 1 hour apart, you can take 2 sets of blood and start antibiotic if the patient is very toxic or subacute variety. But if the patient is stable, like first time stable, you can take 3 sets of blood within 12 hours, even within 6 hours even. But it must be from different venous site. And there is evening swinging fever, that I don't know actually.
And you said 3 samples in acute, so 3 samples, 1 hour difference or what?
Yes. In American Heart Association,
Hmm.
actually British Heart Association, I did not find this topic. In
Hmm.
American Heart Association, they said even within 6 hours, you can take 3 samples of blood. Okay. But what I feel, more we delay, 6 hours we cannot delay for infective endocarditis. So, and they said also that 1 hour delay is okay, 1 hour apart. You take 3 sets of blood. So there is
Nice.
not specific criteria, okay, like this. But in our AKP, there was one question that how many sets of blood minimum required to treat? Answer was 2 sets of blood in AKP. So
Yes,
even if you
fine.
take 2 sets of blood, then start antibiotic, it is okay.
Yeah, this modified Duke's criteria the previous Duke's criteria was 2 sets of blood, but the modified Duke's criteria says that if you have a regular organism, then you can take 2 sets of blood. But if you have an sort of organism which is not common, uncommon, or what can you say, atypical type of organism, then you need to
Hasek
take
group.
3 or more than 3.
Yes, like Hasek group. Yeah.
Good. Actually, I had one question only. When Sandeep was asking you that what are the complications, so that time you mentioned splinter hemorrhage, osler knots. So should we mention these things in complication? I'm not sure it.
These are the manifestation actually. It is
Mm,
embolic manifestation.
these are signs.
Signs. You can say necrosis of the limb, distal limb. This is a complication due to thrombus.
Thrombo,
There is
thromboembolism,
necrosis. Yeah, due to necrosis of the ischemic part.
Right.
thromboembolism, stroke,
Main complication will be stroke.
hemiplegia.
Main complication will be stroke, pulmonary hemorrhage, renal infarct, lung abscess, brain abscess.
Yeah, I asked all these questions in the history, but could not. In the history,
Otherwise,
I asked everything
yeah,
about hemiplegia, about the abscess, blood in the sputum, coughing.
He asked very direct, like, did GP told you that you have splenomegaly?
Yeah, actually, the thing is that I think in the UK, because most of my colleagues told me that they know everything. So you can ask, like, spleen is not a jargon, enlarged spleen is not a, splenomegaly is a jargon, but you should ask, did the GP told you anything about enlarged spleen or enlarged liver? Should be like this, not splenomegaly. You can ask them.
Another question. Did you ask about the last that mom, is there anything I did not ask that is important? You
That is
feel
very, very important. Very, very important question which I missed, and this is very important. Yeah.
Also, like,
because mother's concern. Mother's
like,
concern.
yeah, what I feel like maybe I'm not correct. Like we have assumed that the child had infective endocarditis. Actually, fever could have been analyzed in a little better way also. Like
Actually, I
GI
asked him.
symptom, respiratory symptom. It can be enteric fever also. May not be infective endocarditis.
Yeah, the thing is that
It
if
can be
you have
pneumonia
already,
also. It can be pneumonia also. It may not be this infected endocarditis. Little bit systemic review could have been added, like cough cold, loose motion, vomiting, loss of appetite. I feel so.
yeah,
I don't know, rash over the body. Rash you asked, obviously.
actually, if you like take the past history in account, like there was a cardiac surgery and there is fever for 2 weeks, so most of the things which come into your mind is infective endocarditis, rheumatic heart
Right,
disease, or JIA, systemic JIA. So I asked about the things and I ruled out all of them, SLE even. So it was a boy, so I kept that at the end. But
No, it was
yeah, you're right.
It was
You
very
need
good
to ask.
history actually. Apart from the missed point, I'm just suggesting like can we do add this point in the history?
No, you are right. I think the cough, cold, and all, it's need to be asked. This, like any fever, you have to include cough, cold, diarrhea, vomiting.
Actually, I asked him one question. If you remember the role player, if you remember, that is there anything associated with the fever, like rash, like pain, like cough, like anything? And he told me, no, it is the only fever.
Okay.
But you're right. You're right. You need to ask a bit more, like pain abdomen, like burning urination. Like you need to rule out Kawasaki even because 4-year age. You're right. Yeah.
It was good, actually. It was good.
Like
You did good.
unprepared candidate doing this type of history, then Dr. Tahir, Dr. Tahir will take examiner's exam in the exam if he is prepared.